3. Hi, my name is Nicole Kelly, and I'm a student occupational therapist with the University of St. Augustine, and I did an AOTA CAP on the short-term effects of interferential current electromassage in adults with chronic non-specific low back pain, a randomized control trial. And as you can see, the study was done in 2013, so it's relatively recent. The purpose of the study was to determine how a combined therapy of interferential current and massage compare with superficial massage therapy in producing improvements in muscle function and capacity and producing immediate pain relief in individuals experiencing nonspecific chronic low back pain. The type of study was a single-blinded randomized control trial, and it was level 1 evidence, and this was because individuals were randomized into an intervention and control group. For methodology, the participants in the study were clients with nonspecific low back pain who were referred by their primary care provider between September 1st, 2011 and February 1st, 2012. 62 subjects were randomly assigned to the intervention or control group by a trained physical therapist. Through the use of a computer-generated software, a table of numbers was randomized with corresponding participants in order to conceal allocations. Individual index cards that were numbered sequentially were prepared in a 1-to-1 ratio and were placed in an envelope by the first therapist. Then a second therapist opened the envelope and proceeded with the treatment based on the specific assignments. For the inclusion criteria, they needed to be 18 to 65 years old to participate. They needed to have lower back pain for greater than or equal to 3 months. They needed to receive a score of greater than or equal to 4 on the Roland-Morris Disability Questionnaire. They were unable to achieve flexion relaxation of the lumbar muscles during trunk flexion, and they were not currently receiving physical therapy services. For the exclusion criteria, they were not able to have spondylolisthesis or fibromyalgia. They could not have a presence of lumbar stenosis. If they had clinical signs of radiculopathy, if they had a history of therapy involving neuromuscular kinesiotape or a history of spinal surgery, they had any diseases within the central or peripheral nervous system, or if they had corticosteroid treatment within the past 2 weeks. The intervention and control groups participated in a 10-week period treatment, and they received treatment 2 times a week, totaling 20 treatment sessions. The intervention group included 31 individuals who received massage with interferential current located in the dorsal-lumbar and lumbar area of the back. The IFC was administered through bipolar application. There was a carrier frequency of 4,000 Hz at constant voltage. The amplitude modulation was 80 Hz, and the stimulation intensity was 30 to 50 milliamps. The treatment was administered using 2 8x10 centimeter rubber electrodes to which sponges were attached. The 2 sponges were soaked in water and then moved over both the dorsal lumbar and lumbar regions for 30 minutes. The control group also included 31 individuals who received treatment consisting of superficial manual massage, and this included superficial pressure, which consisted of static and light pressure on both sides of the vertebrae. They received effleurage, which the strokes were directed towards the heart, and they received skin rolling through a petrissage technique. The massage was performed using both hands on the lower back region for 20 minutes. For the results of the study that were statistically significant, for group times time interactions, the 2x2 mixed model ANOVA test showed statistical significance for the following: the visual analog scale, the Roland-Morris Disability Questionnaire, the Oswestry Disability Index, and quality of life. For clinically significant results, compared to the control group, the intervention group showed greater post-treatment improvements in the following: pain visual analog scale, range of motion for trunk anaflexion, the McQuaid test, the Roland-Morris Disability Questionnaire, and quality of life. For the strengths of the study, it was a single-blinded randomized control trial that had a high level of adherence and this was because there was only one loss to follow-up. The study was reliable and valid because there was shown to be a decrease in pain and disability in previous studies done. But this was the first study to demonstrate that IFC electromassage therapy was effective in reducing pain and disability, specifically for individuals with chronic low back pain. For the limitations of the study, the effect of the study are medium and average, and this was because the medium score on the visual analog scale was 1.67 centimeters, and 2 centimeters was the minimum required score to be considered clinically worthwhile. The results were not representative of all individuals with low back pain, and this was because the population came from a specific university. The study did not observe the long-term effects of the treatment, and the ethics committee did not allow client follow-up. For the significance and implications to OT practice, the non-specific chronic low back pain is very commonly seen in individuals. According to the article, 80% of the general population is affected by chronic low back pain at some point during their lifetime. Furthermore, chronic low back pain is associated with greater healthcare costs and more time lost at work than any other disease. Because this condition has such a high prevalence in various populations, it is beneficial for occupational therapists to know that interferential current can help reduce the symptoms experienced with low back pain. This knowledge will encourage therapists to use IFC treatment for this population in order to produce greater outcomes. How do I plan to use the results from this study? I plan to use the results from the study to educate clients on the effectiveness of interferential current electromassage on reducing pain and disability, as well as improving the overall quality of life. In this study, clients received IFC electromassage alone, without the inclusion of other rehab treatments. I will use this information to do further research on the use of interferential current in combination with different treatment methods, because it is not likely for occupational therapy to provide IFC as a standalone treatment. I will also incorporate functional activity during or following the use of the modality as a future occupational therapist. Thank you.